Hi, Emma. Can you explain the blood supply to the lungs?
Of course. The blood supply to the lungs, known as vasa pulmonum, consists of three main types of blood vessels: the pulmonary arteries A, pulmonalis, the pulmonary veins versus pulmonales, and the bronchial arteries AA bronchials.
What is the role of the pulmonary arteries?
The pulmonary arteries are crucial as they carry deoxygenated blood from the right ventricle of the heart to the lungs. They branch into two main arteries, which then divide alongside the bronchi into segmental branches. This branching continues to follow the bronchial tree down to smaller segments. The primary function of the pulmonary arteries is to transport blood low in oxygen and high in carbon dioxide to the lungs for gas exchange.
How does the blood get back to the heart?
That's where the pulmonary veins come in. These veins carry oxygenated blood from the lungs back to the left atrium of the heart. Unlike the arteries, the veins don't follow the same segmental organization. Instead, they gather into several large trunks and travel almost perpendicularly to the arteries. Interestingly, the walls of the pulmonary veins contain myocardial cells, which can sometimes be a source of arrhythmias.
And what about the bronchial arteries?
The bronchial arteries are part of the nutritional circulation. They originate from the aorta and the intercostal arteries, and their primary role is to supply the lung tissues, including the alveoli, interstitium, and bronchial walls, with nutrients and oxygen. Under normal conditions, these arteries are quite thin, but in cases of chronic lung diseases, they can hypertrophy or enlarge to meet the increased demand.
How do these vessels interact within the lungs?
The pulmonary arteries and veins have distinct paths. The arteries closely follow the segmental structure of the lungs and branch along with the bronchi. In each lung segment, the arteries are centrally located. In contrast, the pulmonary veins are more peripheral and don't adhere to the segmental arrangement. They course through the periphery of each segment, eventually converging towards the heart.
That makes sense. So, the arteries and veins serve different purposes and have unique pathways within the lungs.
Exactly. The pulmonary arteries and veins work together to facilitate gas exchange, arteries bringing deoxygenated blood to the lungs, and veins returning oxygenated blood to the heart. Meanwhile, the bronchial arteries ensure the lung tissues themselves receive adequate nourishment. This efficient organization supports the lung's vital role in respiration.
Thank you for the detailed explanation. It's fascinating how the body has such a complex yet well-organized system.
You're welcome. Understanding the blood supply to the lungs is fundamental to grasping how our respiratory system functions, especially in both health and disease.
Can you explain the functional circulation of the lungs?
Absolutely. The functional circulation of the lungs primarily involves the pulmonary artery A, pulmonalis, which originates from the right ventricle of the heart. This artery branches into two main arteries, known as the left and right branches ramus sinister et dexter, entering the lungs at the pulmonary hilum. It carries deoxygenated blood with low oxygen content and high carbon dioxide content to the lungs.
How does this branching continue within the lungs?
Great question. Within the lungs, the pulmonary artery further divides into lobar branches rami lobers. On the left side, it splits into upper and lower branches, while on the right side, it splits into upper, middle, and lower branches. These lobar branches then divide into segmental branches rami segmentals, with 10 segmental branches on each side of the lungs.
What happens after the segmental branches?
The segmental branches further subdivide into subsegmental branches rami subsegmentaires and then into lobular branches rami lobulars, which direct blood into the secondary lobules of the lungs. This is where the capillary network rete capillaire plays a crucial role. The capillaries surround the alveoli, facilitating the exchange of gases. Deoxygenated blood releases carbon dioxide and absorbs oxygen in this network.
So, the blood gets oxygenated in the capillary network?
Exactly. Once the blood is oxygenated, it flows from the capillaries into the interlobular septum and then collects into the pulmonary veins V, pulmonalis, which return the oxygenated blood to the left atrium of the heart from the dorsal side.
What about the nutritional circulation of the lungs?
The nutritional circulation is handled by the bronchial arteries A, bronchialis. These arteries usually originate from the aorta, with variable origins and numbers of branches. Typically, there are two bronchial arteries, one on each side. On the right, they often branch from the third posterior intercostal artery, while on the left, they directly branch from the thoracic aorta. These arteries supply oxygen and nutrients to the lung tissues. In chronic lung diseases, the bronchial arteries can hypertrophy or enlarge, often leading to bleeding into the lungs, known as hemoptysis.
And how is the blood drained from the bronchial circulation?
The blood from the bronchial circulation is drained by the bronchial veins versus bronchioles. These veins drain into the azygous vein, accessory hemiazygos vein, intercostal veins, and ultimately into the superior vena cava.
Can you describe the secondary lobule structure?
Certainly. A secondary lobule typically contains 3 to 5 terminal bronchioles and is surrounded by the interlobular septum. The pulmonary vein and lymphatic pathways run within the septum. Deoxygenated blood flows through the center of the secondary lobule, while oxygenated blood drains outward along its periphery.
What is the pulmonary hilum, and why is it important?
The pulmonary hilum is a vital structure that connects the lungs to the mediastinum. It contains several important components: the bronchi, branches of the pulmonary artery carrying deoxygenated blood, pulmonary veins carrying oxygenated blood, the bronchial arteries for nutritional supply, nerves, lymphatic vessels, and lymph nodes. The arrangement within the hilum can vary. On the right side, the bronchus is positioned highest, and the pulmonary veins are lowest. On the left side, the pulmonary artery is highest, with the bronchus positioned below it, and the pulmonary veins are lowest.
This makes the pulmonary hilum quite a complex structure.
Indeed, it is. The pulmonary hilum plays a critical role in organizing the passage of air, blood, and nutrients into and out of the lungs, ensuring efficient respiratory and circulatory function.
Thank you for the detailed explanation. It's incredible how intricately organized our lungs are.
You're welcome. The complexity and efficiency of lung circulation are key to our ability to breathe and oxygenate our blood effectively. Understanding these mechanisms is fundamental for anyone studying respiratory physiology or medicine.